High blood pressure, hypertension. High blood pressure, hypertension, is a common condition in which the pressure of the blood against the artery walls is high for a long time. Enough that it can eventually cause health problems, such as heart disease. 1. Formation of hypertension. Blood pressure is determined by the amount of blood your heart pumps, and the amount of blood that interferes with the flow of blood in your arteries. The more blood your heart pumps and the narrower your arteries are, the higher your blood pressure will be. You can have high blood pressure, hypertension, for many years without any symptoms. Even without symptoms, damage to your blood vessels and heart continues and can be detected. Uncontrolled high blood pressure increases your risk of serious health problems, including heart attack and stroke. High blood pressure usually develops over many years, and it eventually affects most people. Fortunately, high blood pressure can be easily detected. And once you know you have high blood pressure, you can work with your doctor to manage it. 2. Causes of hypertension. There are two types of high blood pressure. 2.1 Primary essential hypertension. For most adults, there's no identifiable cause of high blood pressure. This type of high blood pressure, called primary essential hypertension, tends to develop gradually over many years. 2.2 Secondary hypertension. Some people have high blood pressure caused by an underlying condition. This type of high blood pressure to secondary hypertension tends to appear suddenly and cause higher blood pressure than does primary hypertension. Various conditions and medications can lead to secondary hypertension, including adrenal gland tumors, certain defects you're born with congenital in blood vessels, certain medications, such as birth control pills, cold remedies, decongestants, over-the-counter pain relievers and some prescription drugs, kidney problems, illegal drugs, such as cocaine and amphetamines, difficulty breathing while sleeping, thyroid problems. 3. Symptoms of hypertension. Most people with high blood pressure have no signs or symptoms, even if blood pressure readings reach dangerously high levels. A few people with high blood pressure may have headaches, shortness of breath or nosebleeds. However, these signs and symptoms aren't specific, and usually don't occur until high blood pressure has reached a severe or life-threatening stage. 3.1 Regularly check for high blood pressure. You'll likely have your blood pressure taken as part of a routine doctor's appointment. Ask your doctor for a blood pressure reading at least every 2 years starting at age 18. If you're age 40 or older, or you're 18 to 39 with a high risk of high blood pressure, ask your doctor for a blood pressure reading every year. Blood pressure generally should be checked in both arms to determine if there's a difference. It's important to use an appropriate sized arm cuff. Your doctor will likely recommend more frequent readings when you've already been diagnosed with high blood pressure, or have other risk factors for cardiovascular disease. Children age 3 and older will usually have blood pressure measured as a part of their yearly checkups. If you don't regularly see your doctor, you may be able to get a free blood pressure screening at a health resource fair or other locations in your community. You can also find machines in some stores that will measure your blood pressure for free. Public blood pressure machines, such as those found in pharmacies. They may provide helpful information about your blood pressure, but they may have some limitations. The accuracy of these machines depends on several factors, such as a correct cuff size and proper use of the machines. So, ask your doctor for advice on using public blood pressure machines. 4. Risk factors of hypertension. High blood pressure has many risk factors, including 4.1 Age. The risk of high blood pressure increases as you age. Until about age 64, high blood pressure is more common in men. Women are more likely to develop high blood pressure after age 65. 4.2 Being overweight or obese. The more you weigh, the more blood you need to supply oxygen and nutrients to your tissues. As the volume of blood circulated through your blood vessels increases, So does the pressure on your artery walls. 4.3 Certain chronic conditions. Certain chronic conditions also may increase your risk of high blood pressure, such as kidney disease, diabetes, and sleep apnea. 4.4 Drinking too much alcohol. Over time, heavy drinking can damage your heart. Having more than 1 drink a day for women, and more than 2 drinks a day for men may affect your blood pressure. If you drink alcohol, do so in moderation. For healthy adults, that means up to 1 drink a day for women, and 2 drinks a day for men. 1 drink equals 12 ounces of beer, 5 ounces of wine or 1.5 ounces of 80-proof liquor. 4.5 Family history. High blood pressure tends to run in families. 4.6 Not being physically active. People who are inactive tend to have higher heart rates. The higher your heart rate, the harder your heart must work with each contraction, and the stronger the force on your arteries. Lack of physical activity also increases the risk of being overweight. 4.7 Race. High blood pressure is particularly common among people of African heritage, often developing at an earlier age than it does in whites. Serious complications, such as stroke, heart attack and kidney failure, also are more common in people of African heritage. 4.8 Too much salt, sodium, in your diet. Too much sodium in your diet can cause your body to retain fluid, which increases blood pressure. 4.9 Too little potassium in your diet. Potassium helps balance the amount of sodium in your cells. If you don't get enough potassium in your diet or retain enough potassium, you may accumulate too much sodium in your blood. 4.10 Using tobacco. Not only does smoking or chewing tobacco immediately raise your blood pressure temporarily, but the chemicals in tobacco can damage the lining of your artery walls. This can cause your arteries to narrow and increase your risk of heart disease. Secondhand smoke also can increase your heart disease risk. 4.11 Stress. High levels of stress can lead to a temporary increase in blood pressure. If you try to relax by eating more, using tobacco or drinking alcohol, you may only increase problems with high blood pressure. Sometimes pregnancy contributes to high blood pressure, as well. Although high blood pressure is most common in adults, children may be at risk, too. For some children, high blood pressure is caused by problems with the kidneys or heart. But for a growing number of kids, poor lifestyle habits, such as an unhealthy diet, obesity and lack of exercise, contribute to high blood pressure. 5. Complications of hypertension. The excessive pressure on your artery walls caused by high blood pressure can damage your blood vessels, as well as organs in your body. The higher your blood pressure and the longer it goes uncontrolled, the greater the damage. Uncontrolled high blood pressure can lead to complications including 5.1 Aneurysm. Increased blood pressure can cause your blood vessels to weaken and bulge, forming an aneurysm. If an aneurysm ruptures, it can be life-threatening. 5.2 Dementia. Narrowed or blocked arteries can limit blood flow to the brain, leading to a certain type of dementia, vascular dementia. A stroke that interrupts blood flow to the brain also can cause vascular dementia. 5.3 Heart attack or stroke. High blood pressure can cause hardening and thickening of the arteries, atherosclerosis, which can lead to a heart attack, stroke or other complications. 5.4 Heart failure. To pump blood against the higher pressure in your vessels, the heart has to work harder. This causes the walls of the heart's pumping chamber to thicken, left ventricular hypertrophy. Eventually, the thickened muscle may have a hard time pumping enough blood to meet your body's needs, which can lead to heart failure. 5.5 Metabolic syndrome. This syndrome is a cluster of disorders of your body's metabolism, including increased waist circumference, high triglycerides, low high-density lipoprotein (HDL) cholesterol, the good cholesterol, high blood pressure and high insulin levels. These conditions make you more likely to develop diabetes, heart disease and stroke. 5.6 Weakened and narrowed blood vessels in your kidneys. This can prevent these organs from functioning normally. 5.7 Thickened, narrowed or torn blood vessels in the eyes. This can result in vision loss. 5.8 Trouble with memory or understanding. Uncontrolled high blood pressure may also affect your ability to think, remember and learn. Trouble with memory or understanding concepts is more common in people with high blood pressure. More information. Treatment of high blood pressure at 247naturalhealthtricks.com. In particular, the simple exercises that lower high blood pressure. Right now, right where you're sitting, free solution. Link in the description. Thanks for watching. Do not forget like, share, and comment with us.